Hi, I'm Rich Colgard, publisher of Forbes. I'm here today north of Chicago in Deerfield, Illinois at the corporate headquarters of Walgreens with Tim Theriot, the Senior Vice President and Chief Information Officer, and Mark Wagner, the President of Operations and Community Management. You know, we've now moved into the era of cloud computing and ubiquitous bandwidth. As you think out 5 years, knowing what is going to happen with processing power, storage, bandwidth, and maybe a surprise here or there, what does this do in the consumer's life, and how will that be incorporated into your stores?
Well, Walgreens, we're in a very ambitious transformation from a technology standpoint, and the banner of which we've called it is Walgreens 2.0. We've had to really invest heavily in a new infrastructure, really support this vision of the next 5 years. And some of the components are a brand new data center. We're developing all new capability under something we call Health Cloud. One of the things we're piloting right now is the ability for someone who's about to be discharged from a hospital and have a video conference session with a pharmacist remotely.
Our strategy of transforming community pharmacy is all about lowering the overall healthcare costs for our employers and the other managed care organizations that we work with. Part of what IT has helped us with is, you heard Tim mention video conferencing in for adherence and for counseling, but it's also about making it easy and making it simple for patients to understand the medication, to understand on how they even receive it and when they want to receive it.
Walgreens has an incredible 250,000 or so employees. How do you communicate to that large an employee base and get everybody to kind of understand the common vision and the goals of the company?
Making sure we're connected with our employees is critically important. So we have a program called Cloud9, and the reason it's called that because these services will come from the cloud, and there are going to be 9 key benefits that our employees will each get, from simple as a new email system that comes from the cloud, the ability to access these through mobile devices, ability to share documents in the cloud, full collaboration of video conferencing and text messaging back and forth. So there's a whole, also has Wi-Fi across campus, we in fact just completed. Then with this common platform, the ability to create groups that can then have social networking together.
What do you think about the larger question of a social network for healthcare? Will that be part of this new infrastructure of modern healthcare?
I believe it will be. I think the opportunity for us at Walgreens, a lot of people already trust their information with us today. So from there, I think we can do more and more to help them. I truly believe the idea of being able to exchange information in a secure manner, that's something we're actively working on. So we can sit really at the hub of sharing this information in a secure manner to those who need to know when they need to know it. And also technology can intervene in appropriate time and give insights, say if someone's certain measures are out of line, that maybe then some intervention is required rather than waiting to move to a more catastrophic state.
And there are now 13,000 and a growing number of healthcare apps just on the iPhone and iPad alone, and yet they really connect to nothing. I mean, there's nothing that connects them to the payers and the providers and the docs.
Yeah, you know, really, Rich, when you think about it, healthcare is really local, and people love the relationship with their pharmacists. Year after year, survey after survey has demonstrated that pharmacists are always on top of the most trusted profession. And so with the ability with the Cloud9 and harnessing and leveraging all the infrastructure on the IT side here in our headquarters down to each 8,000 different locations across the United States, and then on top of that, not only there, but even in our distribution centers and our take care clinics, and bringing that all together with the health information that people want and going to a place that they trust, plus it's right in their neighborhood.